Hello, my name is Emma Shore, and for my clinical diagnosis presentation, I chose to do traumatic brain injuries, or TBIs. So, a TBI occurs when an external force injures the brain. This can be through a hit to the head, an object piercing the skull, or when the body is shaken hard enough to be able to slam the brain into the skull. Some of the leading causes of a TBI are motor vehicle accidents, being struck by an object, an assault, or specifically in young people, sports and different kinds of recreational activities. So, a mild TBI is more oftenly known as a concussion, and it can come with a wide array of different kinds of symptoms, including headaches, confusion, lightheadedness, dizziness, blurred vision, ringing in the ears, sleep disturbances, memory and concentration problems, mood changes, nausea, sensitivity to light and sound, loss of consciousness. The list goes on. Um, when we're looking at a moderate to severe TBI, symptoms can include a worsening headache, loss of vision in one or both eyes, repeated vomiting, slurred speech, seizures, numbness, uncoordinated movements, and a significant loss of consciousness that could be minutes to a couple of hours. Different ways that TBIs can be diagnosed vary pretty heavily. It's usually a combination of multiple measures that are used to diagnose TBIs. The most common ones are different kinds of imaging tests, most often CTs or MRIs. There's what's known as the Glasgow Coma Scale, where a higher score is a more mild concussion, and if you're down under 8, that is a severe TBI. Different kinds of tests are also used, including speech and language tests, social communication skills, tests of your swallowing and breathing abilities, cognition tests, and also blood tests are a common way to diagnose TBIs. Different proteins are looked for in the blood that are released by the brain when a TBI has been um, suffered by an individual. Um, and one of these proteins is the tau blood protein, which is often used in post-injury recovery monitoring. So this is just a general overview of TBI classification. In your mild TBI or your common concussion, you either did not lose consciousness or you're unconscious for less than 30 minutes. No memory loss to minimal memory loss, and your Glasgow Coma Scale number is a higher number, usually 13 to 15. In your moderate TBI, you're unconscious for a more significant period of time, 30 minutes up to a day, memory loss from a day up to a week, and that more intermediate level of the Glasgow Coma Scale rating. And then for your severe TBI, you're unconscious for more than a day, memory loss more than a week, and a significantly low Glasgow Coma Scale number. For a mild TBI, um, your typical treatment is just rest and slow return to activities, avoiding alcohol and drugs as that could slow your recovery or give you a greater risk of re-injury, taking frequent breaks from cognitive activities as that intense concentration can tire out the brain quickly, and just monitoring symptoms over time to ensure that nothing becomes worse as you're trying to recover. For severe TBI, you'll frequently see a need for emergency treatment, which is the main priority is stabilization, making sure oxygen supply to the brain is under control, blood pressure, brain pressure, all has to be under control. Sometimes surgery will be required to remove blood clots, repair skull fractures, or relieve intracranial pressure. And then a list of different medications could be used for severe TBI, including anti-anxiety medications, anticoagulants, anticonvulsants, antidepressants, and the list goes on. Rehabilitation therapy is often used for even smaller concussions. You'll see some of these different therapies used, but your more severe TBIs will see more combinations of these therapies used. And this can include physical therapy for general strength, balance, and flexibility, occupational therapy for relearning your daily tasks. You may need to go to speech therapy or psychological therapy, and then some vocational and cognitive rehabilitation as well. Some immediate effects and complications you could see from a TBI are seizures, nerve damage, blood clots leading to strokes, and coma and brain infections. These are typically within a couple hours, maybe a couple of days of your TBI. In the more long-term sense, You could see some cognitive issues that include difficulty learning, remembering, and reasoning. You could have sensory impairments that includes double vision, loss of taste, ringing in your ears, and different nerve issues. Communication could become an issue going forward with a TBI, including talking, reading, and explaining your thoughts and emotions. Behavior can also become an issue, different kinds of social difficulties in relationships and self-control. Emotional problems are also often seen. You can see higher levels of depression, anxiety, and mood swings are common after TBI. And then you have the risk of inheriting different degenerative diseases, including Alzheimer's, Parkinson's, and what is called chronic traumatic encephalopathy, or CTE, which is a degeneration of the brain cells over time. And with this disease, the only way to properly diagnose it is through autopsy. A blood protein that I mentioned earlier was blood protein tau. This has been an up and coming area in TBI research, as blood protein tau is something that they are looking into more um, in terms of long-term recovery, as this is what can lead to that CTE disease that is, as of right now, impossible to diagnose in a living person. So this tau protein stabilizes the microtubules that are in the neurons, which are how the neurons communicate with each other. A TBI causes this protein to detach from the neuron, leading to damage, and research has shown that elevated tau levels in the blood are seen in many severe TBI cases. Um, Looking for blood protein tau is a potential diagnostic tool for risk assessment as well. This image shows what a healthy microtubule is supposed to look like in the top part, where protein tau is around the tube stabilizing it. But in a damaged neuron, you can see that the proteins have now detached from the tubule and have caused this tangle that now gets lodged in the bloodstream, and the neuron itself is not stabilized to be able to transmit electrochemical messages anymore. Looking into the relationship between TBI and criminal behavior, I looked at a couple of different groups of people and how TBIs translate into criminal behavior. One study that I found looked into females and violence, and incarcerated females did have higher TBI rates than the general population of incarcerated people. There were also links with mental health disorders and a history of abuse. Females with TBI frequently had anxiety, depression, and substance abuse, which could amplify their violent tendencies. Um, TBI causes structural and functional changes in the brain regions responsible for impulse control, emotional regulation, and aggression, which is why females in this study and people in general do tend to see higher rates of being incarcerated. Um, in juvenile offenders as well, they often saw poor social skills and cognitive impairments as a result of TBIs early in childhood. There are also increased likelihoods of psychiatric issues and self-harm in juvenile offenders that had suffered TBIs early in childhood, and higher recidivism rates even in teenagers that were committing crimes. Looking into TBI and criminality causal links, as I said before, TBI can cause impulsivity, aggression, and dysregulation in the brain. Um, Many studies also brought up the topic of reverse causation, where criminal behavior may lead to being more likely to experience a TBI, whether it is when you are in the process of committing a crime, you're putting yourself into that dangerous scenario, or in prison, you are at risk of getting hurt in a way that causes TBIs down the line. So it's kind of this cycle of suffering a head injury, being prone to impulsivity and aggression, and then you're in another situation where you're just going down and spiraling down. Studies also showed that childhood behaviors were linked to future head injuries and crime. Aggression as young as age 3 was documented, and that predicted future criminality. The study said that 3-year-olds who were not well adjusted were more likely to be diagnosed with antisocial personality disorder, be repeat offenders, or be convicted of a violent offense. Also, children who are more prone to bullying were linked to seeing property and traffic offenses as early as their young teens. Some evidence-based interventions that came up in research for TBI and aggression. Um, Amantadine was one medicine that was being studied as a possible intervention. The study did not see any difference at 1 month into taking the medication, but did show significant improvement in limiting aggression in individuals after 2 months. So that is an area that is up and coming in research. Cognitive rehabilitation has also shown good outlooks for individuals with TBIs, specifically focusing in on getting early MRIs after suffering a head injury for prognosis, and then memory strategies and self-awareness training, as being aware of your issues with impulsivity and aggression is the important first step in moving forward with being able to make yourself better. Some correctional interventions were also suggested as a uh, potential solution for those with TBI, um, including psychoeducation for prison staff, families, and patients, as everyone involved in the betterment of the patient is important to be aware of what's going on and the best ways to help that person, as well as mental health care for all inmates and not just those with TBIs. Some future directions that the research is pointing to is advancements in being able to diagnose PTIs or TBIs with PET scans, including those tau binding tracers to be able to find the tau proteins that have been denatured and are now in the bloodstream, along with fluid-based biomarkers for early detection of TBIs. Another important thing is better understanding of CTE and its risks. One thing that research has not been able to pinpoint yet is why some people develop CTE while others don't. There doesn't seem to be any kind of a significant pattern that has been um, discovered yet on why some people have CTE while others don't. There's also a significant need for gender-specific research in this area and the overall goal of trying to diagnose a living person with CTE so we can look into how to treat that. Uh, Early screening and rehabilitation is a very important part of TBIs, especially within the justice system, and then prevention strategies for high-risk youth as well, so they don't fall into that cycle early on in life. And just various improved rehabilitation methods, including long-term recovery support, and then peer mentorship and community-based programs to be able to help people re-enter the community in a safe way for both them and those around them. And that is all I have on TBIs. Thank you.